Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Let's talk about the Ozempic Face aging problem and how you can fix it. My name is Dr. Kristen Herzog. I am a board-certified nurse practitioner who specializes in facial aesthetics. Thanks for tuning in to the Perfect Dose podcast. So let's get into it, you guys. We are seeing a ramp up in GLP-1s, Ozempic, Tirzepatide, also known semaglutide, Mounjaro. These are weight loss medications that work by quieting the food noise. So they are going to mimic the GLP receptors in your body, which make you feel full faster. They also reduce cravings. So this is going to be something that people are utilizing to lose weight. They're utilizing it for inflammation, to quiet food noise, and they're becoming more and more popular. What we're finding is on these medications, though, not only are we losing weight in our bodies at a rapid rate, but we're seeing it in our face, and people are actually looking older, they're looking more hollow, and their skin laxity is getting worse. So let's talk about why this is happening. Number one, as we age, we lose fat. And this is a very interesting concept for people to understand because we lose deep fat. So deep fat helps lift and support our face. As we age, we lose that deep fat. However, there's some really fun fat pads that actually get bigger with age. In particular, the nasolabial fat pad and the jowl fat pad. These are going to grow and get bigger, which is so annoying. Everything else is deflating. Not only do we have this deflation, but we have this descension of our fat pads. And then those fat pads in particular are actually getting heavier and bigger. So I like to think about this in vectors. If one's getting bigger while one's getting smaller, it's going to be accentuated. So that's why when we're on Ozempic, we're like ramping this up. This is going to happen as we age, but it happens slowly and gradually over time. When you utilize Ozempic and you're losing fat at a rapid rate, you are going to see this much faster than you would if you were losing weight not on Ozempic. So you're going to see these fat changes, these facial aging changes almost ramp up. So think about GLPs as like a revving, speeding up of the aging process in your face. So if you're listening to this, you might be like, holy cow, I don't know if I want to be on Ozempic because I don't want to experience faster aging in my face. And the key with this, you guys, is number one, we need to make sure we're not losing weight too fast. So this is something that I explain to my patients in my practice. I offer GLP-1s. We do semaglutide, tirzepatide. We have a weight loss protocol. But with that, we're making sure our patients are losing weight at a safe rate, meaning 1 to 2 pounds a week. If you're losing more than 1 to 2 pounds per week, it may be really fun and exciting because you're getting skinny quick. Trust me, I can absolutely relate to that, especially being pregnant. All I can think about is getting skinny quick, but it is not safe. You're actually losing muscle, not fat. And when you lose muscle, you are not going to retain this weight loss. What's going to happen is the more muscle you have, the less fat your body is going to put on. So it makes gaining weight back harder. When you're losing muscle and you get off these GLPs and you start eating again, you're going to gain weight rapidly. So number one is to not lose weight at a super fast rate. Now, the next thing, because even if you are losing weight at a safe rate, which is 1 to 2 pounds per week, it's still pretty fast and rapid in comparison to normal weight loss without these GLPs. So you're still going to see facial aging. Now, what can we do? So in my practice, I put a protocol in place. When my patients have lost 15 pounds, we're going to start a biostimulator, and that's going to be Sculptra. Sculptra is a biostimulator. What it does is it forces your body to stimulate its own natural collagen. I like to use this garden visualization kind of analogy. So basically how I explain Sculptra is the fertilizer. So imagine a garden and you sprinkle fertilizer all around it. Flowers, plants are going to grow faster. So Sculptra is this fertilizer, and instead of flowers and plants growing, you're growing collagen, which is going to thicken your skin. Collagen keeps our skin firm, bouncy, tight, and elastic. So at that 15-pound weight loss mark, I put my patients on Sculptra to help prevent skin laxity. I also have them treat with a laser like Morpheus, which is going to use radio frequency microneedling to tighten the skin. So we try to be preventative, not corrective, because it is very hard to correct Ozempic face. It's much easier to prevent Ozempic face. So if you're on Ozempic, you need to consider a biostimulator like Sculptra and a radio frequency microneedling treatment like Morpheus, in addition to making sure you're not losing weight too fast. So eat your protein, lift weights, drink plenty of water, and make sure that you're on a preventative protocol. So what do you do if you've lost more than 15 pounds and you haven't implemented these protocols? Well, it's not too late. We can still treat you. We can still improve your skin laxity with lasers and with biostimulators like Sculptra. You just may need more treatments. So on average, patients will need 1 to 2 treatments per year in general. So if you're on my protocol in my practice, you're going to get a Sculptra and a Morpheus at that 15-pound weight loss mark. And then we're going to do it again 6 months later, just to make sure that we're still stimulating collagen and tightening your skin as you lose weight. Now, if you've lost more weight and we need to start treating with Sculptra and skin tightening, and we're not just preventing, we're correcting, you may need to do more treatments than 2. So we'll start you on a treatment right away, and then we'll assess. It depends how much volume loss you're experiencing. You may need 2 to 3 lasers or 2 to 3 Sculptra treatments in order to maximize results. Now, I want to point out that with weight loss, depending how much weight you're trying to lose, Sculptra and skin tightening may not be all you need. You may need fillers. And that's because, again, we're losing fat as we age in general. So if you ramp this up and you have a dramatic weight loss, like 50 pounds or more, you're going to need some dermal fillers to help mimic those fat pads in addition to Sculptra and biostimulators. So that's something that I talk to my patients about. I typically won't start you on filler until you're within 10 pounds of your weight loss goal. If you're trying to lose more weight, I'm going to wait and just treat you with the Sculptra and the skin tightening lasers until you're closer to that goal. And once you're close to that goal, we're going to need to do dermal fillers. In particular, we'll need to address the mid-face, the superficial fat pads around the chin. Those are just pretty much the basic areas that we'll treat with filler, in addition to the skin tightening and the biostimulators. So if you're on Ozempic or you're thinking about being on Ozempic, make sure you save this episode, take notes, write it down. We need to prevent skin sagging on these GLPs. We're having a ramp up of weight loss. We're already losing fat in our face. So when you rev that up, you're going to look older. But the good news is there's things you can do. Thanks for tuning in to today's episode. I will see you guys next week.